My name is Kevin Truitt. I'm a physical therapist with Foothills at our Glendale location on 59th Avenue 101. I'm an Arizona native, born in Tucson. I went to the University of Arizona for undergraduate. I got my physical therapy education at USC in Los Angeles. I've been a physical therapist for over 10 years. I started in outpatient orthopedics. In 2012, I was hired to be the physical therapist for the Milwaukee Brewers. I started with Foothills in 2017 and have been at our Glendale location ever since. At Foothills, we take a total body approach to assessing and treating overhead athletes, specifically baseball players. The transfer of force from the hips to the core to the shoulder blade to the shoulder and elbow are all connected, and disruptions in that chain can lead to overuse and injury at the shoulder and elbow. And it's really important to make sure that you're assessing an athlete's ability to have good balance, to transfer force through the hips and the core so that they're not using their shoulder and their elbow primarily to generate speed for their pitch. Common injuries we see in baseball players, especially athletes who are older, who are late high school, college, even professional, are injuries to the rotator cuff. These can be strains or even tears, injuries to the labrum, injuries to the biceps tendon, the long head tendon, dysfunction with the shoulder blade, as well as injuries to the elbow, most commonly strains and tears of the medial collateral ligament, which oftentimes require Tommy John surgery, which would be a reconstruction of that ligament. You can have injuries to the nerves as they come down the arm. As far as injuries to younger throwers, such as teenagers, adolescents, Little League elbow is common, which is an overuse or a strain of the inside of the elbow, overuse and pain in the shoulder. And again, this is usually due to too much throwing, not enough rest, or not enough strength and coordination in other parts of the body, leading to overuse and strain on those structures. So when we evaluate baseball players' shoulders, specifically pitchers, one thing that's important to look at is their combined range of motion with external rotation and internal rotation. So in this case, this athlete has about 100 degrees of external rotation and about 30 degrees of internal rotation, for a total range of 130 degrees on his throwing arm. On his non-throwing arm, he's got about 90 degrees of external rotation and about 50 degrees of internal rotation. So that's a total of 140 degrees. So we can see that the total range of motion between the two shoulders is less on his throwing arm versus his non-throwing arm. What we know from research is that now he's at a higher risk of injury to structures such as the labrum or the rotator cuff. So from an intervention standpoint, what we're going to try and do is work to improve his total range of motion. And in this case, we would work to improve his internal rotation, since that's the bigger driver of his total loss, and generally is more of the baseball related loss of motion that we see with throwers. So in addition to the rotator cuff, all the musculature that surrounds the shoulder blade is critically important to having a healthy shoulder and being able to throw the ball. So one exercise that we do to strengthen the middle trap, the rhomboids, and some of these muscles that pull the shoulder blade back is what we call prone horizontal abduction. So the athlete will lie on their stomach, arm will be hanging off the table, and what he's going to do is simply take his arm out to the side while he squeezes his shoulder blade towards his spine, holding for a second, and then slowly controlling down. Okay, just like this. And what he's doing is strengthening the musculature that helps slow the arm down during a throw. Okay, modifications to this would be holding a weight in his hand, going at a different speed, changing his reps and sets. But this is another really solid exercise for strengthening the backside of the shoulder and specifically the mid-scapular region. An example of a good rotator cuff strengthening exercise for a baseball player is sideline external rotation. This exercise strengthens 2 of the 4 rotator cuff muscles, the muscles that are specifically designed to slow the arm down during a pitch or a throw. So in this case, the athlete lays on his side, puts a towel roll underneath their arm, and what that does is it puts the rotator cuff in just a little bit better position to fire. The athlete holds the weight And what they do is he's going to rotate upward, making sure not to pull his shoulder back, but to purely rotate through that shoulder. What that will do is fire his rotator cuff. He'll pause at the top and then slowly lower down. And this has been shown to be a really effective exercise for strengthening the rotator cuff. So let's see a few reps. He comes up, he makes sure to pause, and then he rotates down. And he's doing a good job of keeping the shoulder in plane, keeping his arm against the towel roll, and going nice and slow on the way down. There are multiple phases to rehabilitating overhead athletes, specifically baseball players: range of motion, strength, and in this case what you're seeing done are called plyometrics. We do higher speed, ballistic movements, ball throws, wall dribbles, dynamic stabilizations. We generally will do these later in the rehab as you get closer to actually throwing a ball, as these are higher in difficulty. One sequence of exercises that we like to do here at Foothills involves use of the body blade. There are a number of exercises you can do to strengthen the shoulder and the core. One of my personal favorites involves moving the body blade while you go through your throwing motion. This gives us information on your balance, your ability to transfer your weight from one leg to the other while maintaining your shoulder strength. So simply in this position, what you'll do is you'll start moving the body blade as you come up to your throwing position, come through, keep it moving, stabilize, come back to that stabilized leg, and then repeat. Another exercise that we'll do right before the athlete is ready to initiate a throwing program is what we do at Foothills called sock throws. We'll take a long tube sock, we'll put a baseball in the sock, and what we're going to do is actually go through the throwing motion and let go of the ball. The nice thing about this is the ball will stay in the sock, but we'll actually be able to see the athlete go through the throwing motion, release the ball, and see if it hurts. It's a good gauge to decide whether someone's actually ready to start a throwing program. So all we do is we come here, I've got a 4-seam grip, and I'm going to go through my throwing motion and throw. Okay, grab the ball again, position the sock, go through my throwing motion and throw. So we'll do sets of 15 to 25 throws, a couple sets of that, and if the athlete has good form, no pain, and they recover well from it, that's a good indication that they're ready to start a formalized throwing program.